How common are nasal allergies?
Fairly common, something like 20 to 25% of the U.S. population suffers from nasal allergies.
Why do people have allergies?
Well, the people who have allergies have an immune response that is exaggerated. So basically, when they see trees, grass, weed, cat, dog, dust, and mold coming by their nose, their immune response has a it's hyperreactive. It produces a lot of biochemical mediators, which causes the suffering which is associated with nasal allergies.
Are allergies inherited?
Yes, if one of the parents has allergies, there's a 30-40% chance every kid will inherit the allergies. If both parents have it, 50% chance that every kid will inherit their parents' allergies.
What is a chronic sinus infection?
Chronic sinus infection means there's an inflammation of the lining of the nose and sinuses.
What do patients with chronic sinusitis complain of?
Well, there's a whole bunch of symptoms, some of which include headaches and pressures around the face and eyes, blocked nose, drainage down the back of the throat, clearing the throat a lot, cough, sore throat, hoarseness. The more they talk, the hoarser they get. Their ears feel clogged, pressure, fullness, feel like they're hearing in a tunnel, and their smell and taste could be better.
Do people with chronic sinus infections have nasal allergies?
Some of them do. Something like 30 to 60% of people with a chronic sinus infection have nasal allergies.
What do patients with nasal allergies complain of?
Some of the commoner symptoms would be running nose, sneezing, throat clearing, watery, itchy eyes, congestion. These are the more common symptoms of allergy.
Can you grow out of allergies?
It's possible, but unlikely. You tend to grow into allergies. The older you get, the more you're exposed. The more you're exposed, the worse your symptoms become.
Do people with chronic sinus and nasal allergies have asthma, like wheezing and breathlessness?
Sure, 10 to 30% of people with nasal allergies have asthma-like symptoms, like you say, chest tightness, wheezing, get winded out easily. 60 to 80% of people with a chronic sinus problem have the same asthma-like symptoms. The nose and the lungs are at opposite ends of the same tube, so when your nose goes haywire, your lungs go haywire.
Do chronic sinus problems and nasal allergies affect sleep?
They definitely can. I think the typical person with nasal allergies will find that they have difficulty falling asleep on their back. Their nose gets more and more blocked during the night. They breathe through their mouth. They're thirsty all night long. They snore, they grunt, they groan. They wake up in the morning, they feel like shit. They drag themselves all day. Their memory and concentration sucks. They get more and more pissed off as the day goes by. They can't wait to go home and sleep. The next day is the same or worse. They wake up with a blocked nose, dry mouth, sore throat, and clear their throat a lot or cough.
How do you identify a patient with chronic sinusitis and allergies?
Well, the first thing is to get a good history. Most of the historical points we've already mentioned. So, common symptoms like blocked nose, headaches and pressures around the face and eyes, drainage, throat clearing, cough, sore throat, hoarseness, ears feeling clogged, feeling like you're hearing in a tunnel, unsteadiness, poor smell and taste, watery, itchy eyes, sneezing, running nose. These are some of the common symptoms. The second part of making a diagnosis will be the examination. So you'll see that some of these patients who have allergies, they have a line on their nose that's called a supratip crease, and it comes from them basically rubbing on their itchy nose since the time they were kids. At that time, the nose was still developing, so that crease there is actually a scar, which is there to stay. The other area to look for during the examination are these black rings around the eyes. Those are called allergic shyness. And thirdly, we always do a thorough examination. using a flexible endoscope. It's very comfortable, takes only about 5 to 10 seconds, more ticklish than anything, but basically it allows us to examine the nose, while looking at the image on a TV monitor, and that examination shows us where and if pus is present, whether the patient has or whether the patients have nasal polyps.
How do you treat allergies?
Basically, the three main ways to treat allergies. Number one, avoidance of what we call environmental control measures. Two, allergy medication. Allergy medication blocks the allergic reaction. And three, allergy shots. So for patients who have mild allergies, just avoidance may be sufficient. For people who avoidance alone is not sufficient or cannot avoid the things they're allergic to, then we put them on a number of allergy medicines which all block the allergic reaction in different places. And for those who don't respond as well as they want to the first two treatment modalities, then we add allergy shots.
What is the difference between allergy meds and allergy shots?
Well, allergy shots block the allergic reaction. You take it now, it works now. You don't take it tomorrow, then you're going to miss it. Allergy shots actually change your immune system. Like we mentioned earlier, people with allergies have an exaggerated immune response. So allergy shots actually down-regulate their immune response. So when they get to a good place in their allergy shots, they don't have that exaggerated response anymore.
Who will benefit from allergy shots?
Basically, people who don't respond well to allergy medicines, people who cannot avoid the things they're allergic to, either because their occupation doesn't allow it. They cut grass for a living, they're construction workers, and they're outdoors all the time, they're coal miners, they work in a vet's office. Another group of people that would benefit would be people who don't like taking medicines, people who have bad reaction to the allergy medication, and in general people who have a poor prescription plan or can't afford to be on a whole bunch of allergy medicines to get good control over their allergies.
Do you have any advice for sufferers of chronic sinusitis and nasal allergies?
Sure. I think by the time most people get to our office, they have suffered a lot over years and years. This condition won't kill you, but it can certainly make you feel like you'd rather be dead. So don't be disillusioned or frustrated with your treatment of your sinus problems and allergies. You don't have a medical mystery. You have you have a very simple problem that can be easily treated if you know how. So don't be disappointed. Come visit us and we'll take care of you.
Thank you.